Cardiac arrest is a serious medical emergency. It happens when the heart suddenly stops beating. This stops blood flow to the brain and other vital organs. Quick action is critical to saving a person's life. Knowing the signs of cardiac arrest can help you act fast. One of the most obvious signs is unresponsiveness. If someone is not waking up or responding to touch or sound, they may be in cardiac arrest. Another sign is the absence of breathing. If someone is not taking breaths or only gasping for air, this is a serious sign. Cardiac arrest is a life-threatening condition. It requires immediate medical attention. If you see someone with these signs, call 911 right away. Every second counts in a cardiac arrest situation. As an EMT, your safety is paramount. Before approaching a potentially unresponsive person, ensure the scene is safe. Look for any potential hazards, such as traffic, fire, or electricity. Once you've determined it's safe, check for responsiveness. Gently tap the person's shoulder and ask loudly, "Are you okay?" If there's no response, shout for help. If you're alone, call 911 immediately. If someone else is present, ask them to call 911 while you begin assessing the person. Quickly check for breathing by looking for chest movements. Listen for any sounds of breathing. Feel for breaths against your cheek. This initial assessment helps you understand the severity of the situation and guide your next steps. Calling for help quickly is crucial in a cardiac arrest situation. The sooner advanced medical help arrives, the better the chances of survival for the person in need. As an EMT, you're trained to handle emergencies, but you're not alone in this. If you haven't already, ensure someone has called 911 or your local emergency number. Provide clear and concise information to the dispatcher. Tell them the location of the emergency and that you have an unresponsive person who is not breathing. This information helps the dispatcher send the appropriate resources, including an ambulance and paramedics. Early activation of the emergency response system can be the difference between life and death. Chest compressions are a vital part of CPR. They help circulate blood to the brain and other vital organs when the heart has stopped beating. Performing chest compressions correctly can significantly improve a person's chances of survival. First, position yourself correctly. Kneel beside the person and place the heel of one hand on the center of their chest. Place your other hand on top of the first hand, interlacing your fingers. Keep your arms straight and your shoulders directly over your hands. Push down hard and fast on the chest, compressing it at least 2 inches. Aim for a rate of 100 to 120 compressions per minute. Allow the chest to fully recoil after each compression. This ensures that the heart refills with blood before the next compression. Section 5. Rescue breaths, providing vital oxygen. Rescue breaths are an important part of CPR. They provide oxygen to the person's lungs, which is essential for survival. While chest compressions circulate blood, rescue breaths replenish the oxygen supply. After every 30 chest compressions, give 2 rescue breaths. Tilt the person's head back gently by lifting their chin. Pinch their nose closed using your thumb and index finger. Take a normal breath and seal your mouth over theirs. Blow into their mouth for about 1 second, watching for their chest to rise. If the chest doesn't rise, reposition their head and try again. Give the second rescue breath and immediately resume chest compressions. Section 6. AED, the life-saving device. An automated external defibrillator, or AED, is a portable electronic device. It can deliver an electric shock to the heart. This shock can potentially restore a normal heart rhythm in case of a cardiac arrest. Using an AED as soon as possible can significantly increase the chances of survival. Turn on the AED and follow the voice prompts. Attach the AED pads to the person's bare chest as shown in the diagrams on the pads. Once the pads are attached, the AED will analyze the person's heart rhythm. If a shock is advised, ensure no one is touching the person. Press the shock button as directed by the AED. Immediately resume CPR after delivering the shock, starting with chest compressions. Section 7. Continuing CPR, a team effort. CPR is physically demanding. It's important to work as a team if other rescuers are present. Switch roles every 2 minutes to avoid fatigue. This ensures that compressions remain effective throughout the resuscitation attempt. Continue CPR until one of the following happens. The person shows signs of life, such as breathing or movement. An AED is available and ready to use. Qualified medical help arrives and takes over. You are too exhausted to continue, or the scene becomes unsafe. Remember, the goal of CPR is to buy time until advanced medical help arrives. Your efforts can make a life or death difference for the person in cardiac arrest. Section 8. CPR for EMTs, a life-saving skill. CPR is a crucial skill for EMTs. It can mean the difference between life and death for patients experiencing cardiac arrest. Remember to stay calm, assess the situation quickly, and follow the proper steps for performing CPR. High-quality compressions and early defibrillation are essential for increasing the chances of survival. Don't hesitate to act fast and confidently when faced with a cardiac arrest situation. Your skills and knowledge can help save lives. By mastering CPR, you become an even more valuable asset to your team and the community you serve. Continue practicing and refining your skills to provide the best possible care to those in need.